So this issue is 725 crores fresh capital into the company, and then they have a small portion of offer for sale, and this is mainly to be used for the retiring the debt as well as for buying equipments, and a small portion for corporate expenditure, general corporate expenditure. This will be 725 plus 1 crore and odd shares offer for sale. So it should be below around 1000 crores. So our debt sits in two places. One is the part of this that is in India, and part of it is in GCC. And we are going to actually pay off the large part of the debt in India, because that carries a high interest cost. Whereas in GCC, when you look at the interest costs are much less, it's almost half of what we pay here. So the Indian debt will be retiring. We have a reason why there has been a decline in the income in the 2016. That's mainly because of a one-off effect of a issue in Saudi, where we were supposed to get a large amount from the Saudi Ministry of Health, which is now fully paid, but there was a haircut on that. And that's the reason why this happened. This is a one-time effect on which happened. Now we have the profits which are going up. Even now, if you look at our margins have not gone to the level of what it should be, because there are a large number of new projects being added to the company, and that reduces the profitability and increases the expenditure, which is the reason why our margins haven't gone to that earlier level. See, if you look at historically, we have grown at a CAGR of 25 to 30%, or even more than 30% for the last 8 years or 9 years, if you look at it. But these years, because of the expansion and more of units being added, the profits have taken a small dip. So the occupancy rate varies from country to country, as well as from even unit to unit, depending on the maturity of the unit. If the mature units, you find that your occupancy is in the range of 70 to 80%, whereas ramping up, depending on the year, the first year, second year, it will be very low. But there are many units which are ramping up. So we have this advantage of having a large number of establishments which still has to ramp up, which will increase the profits significantly. One of the important challenges which we face and we will be facing is regarding the HR, getting the good people for healthcare. So whether it be doctors, nurses, paramedical staff, you find that it's a rare commodity, and we have been so far successful in getting people, and we hope that we will be able to continue. So there is another reason also for that, because we have our own medical college, nursing college, as well as paramedical college, which is not part of Aster DM Healthcare, but run by a trust in which I am the managing trustee. So that will help us to reduce dependency on outside workforce, and that I think is a major differentiator with us. This has been a very historic moment for the Indian healthcare. Nearly 50% of the people are going to be covered by a decent insurance. Even earlier there were insurances like there was a scheme where 30,000 rupees was being given for a family and all. But 5 lakhs rupees per year for a family is an amount which can provide them fairly decent treatment even for major illnesses. So I'm sure that this is going to be a game changer in the Indian healthcare scenario, and everybody will be benefited, most importantly the patients, whereas even providers like us will have a significant benefit out of it. Our plan actually was for looking at the metros and tier 1 cities in India, because that is a place where there was affordability. But now we think that we have opportunity even go to the tier 2, 3 cities, where people will have the capability to pay because of this new scheme. So we have been traditionally in South, and we are actually coming up now. We have started off from Kerala, Karnataka now, we have Telangana, we have Andhra Pradesh. Maharashtra also we have a hospital. So we are gradually increasing the spread, but it will be mostly the south and west. And once we stabilize, we will be looking at even north. It's not that we are completely against starting anything in the north. If there is something which is a size of considerable size, where it makes sense for us to invest our time and money, we will definitely look at that. Healthcare sector, everywhere it's a sunshine sector, and it has to be there, even if that's the last thing which people can avoid. So it has got a potential of its own. But India is a place where there is a huge gap between what is there and what is to be. And till now, affordability was the problem. And with this new scheme coming in, and if it is properly implemented, I'm sure that there will be significant amount of improvement in the health of the people, and healthcare providers also will have that benefit.